Bismillahirrahmanirrahim. Assalamualaikum and good morning everyone. Today our group would like to present about skull. So before I start, I would like to introduce our group members, which is first Sharin Amri bin Ahmad Nawawi, me myself Nur Inshira Nadia binti Ishaq, next is Nur Suhada Najiha binti Muhammad Noor, and the last one is Atira Nadira binti Jana Abidin. So here is our overview of the presentation. First, introduction, then anatomical and biomechanical perspective, how skull attached to each other, the anatomical structure are well suited to perform the function, and physiology of muscle contraction for the part assigned, the diagram of skull, and lastly, basic projection of skull radiograph. So here, introduction of our presentation. So skull is bony framework of the head, located on the superior end of the vertebral column or backbone, consists of 22 bones, not including the bones in the middle ears, divided into two parts, which is cranial bone and facial bone. And for the function, to protect the skull and has a supportive structure. There is our diagram of the skull. So next is skull is separated by the ethmoid bone, which is has two main contribution. Firstly is cranial contribution. Ethmoid bone contribute to floor of the cranium, include with cribriform plate and olfactory nerve. Second is facial contribution, middle wall of the orbit and part of the nasal septum. So cranial bone consists of parietal pairs, occipital, temporal, frontal, ethmoid, and sphenoid. So facial bone include mandible, lacrimal bone, palatine bone, and inferior nasal concave, zygomatic bone, maxilla, nasal bone, and the vomer.
Okay, Assalamualaikum warahmatullahi wabarakatuh. I would like to present about the biomechanical of the skull. We have the inferior view of the skull and the superior view of the skull. Okay, the function of the cranial bone is shield for the brain, maintain the anatomical placement of blood arteries, lymphatic vessel, nerve and meninges, membranes. We have two components of the cranial, which is the cranial base and the cranial warts. Okay, cranial base make up by the sphenoid bone, ethmoid bone and the occipital bone. The function is give the brain support, structural support, serve as attachment site for multiple type of muscle and the ligament. For the cranial wart, make up by the frontal bone, parietal and the occipital. The function is shield the top portion of the brain, provide a strong resistance to compression force. Okay. For the birth to adulthood, the biomechanics of the skull influence how it develop and grow. For suture is for the permit a certain amount of expansion during brain development, and environmental and genetic variable can have impact on the overall form of the skull. Next. Okay, next is how they attach to each other. We have three components, which is the temporomandibular joint (TMJ), suture and the frontanet. Okay, I will explain about the temporomandibular joint and suture. We have the picture of the temporomandibular joint. For the temporomandibular joint, skull attached to the mandible by a synovial joint called temporomandibular joint. It's responsible for hinge action, closing and opening the mouth, gliding action, forward and backward movement for the chewing and speaking. For the suture, we have the superior view and the lateral view of the suture. The function is shock absorption of the skull. For irregular interlocking edge of the suture provide strength and decrease chances for fracture. For adult, we have immovable suture, which is synostosis, and for infant, movable amphiarthrosis.
Okay, Assalamualaikum. Now I will explain regarding the suture, the skull. So actually suture is divided into four structures. which is first we have coronal suture. There is a articulation between the frontal bone and also the pair of parietal bone. And then we have lambdoid suture, which is located at the posterior part. It is the articulation between the occipital bone and also the pair of parietal bone. And then we have a sagittal suture, which is located at the top of our skull. There is an articulation between both parietal bone. And then we have a squamous suture, which is the articulation between the temporal bone and also both of the parietal bone on both sides. And then we have brecma. Brecma is the junction between the articulation of the coronal suture and also sagittal suture. And then we have lambda. Lambda is the junction between the lambdoid suture and also the sagittal suture, which is the junction they meet. And then we have the parietomastoid suture, which is the junction of the lambdoid suture and also the squamous suture, which is located at the lateral side. And then we have a fontanelle. Fontanelle actually is have a three main function. First, we have a spacer for the growth of the neighboring skull. And then the second function is to provide flexibility to the fatal skull. And then the third one is to allowing the skull to change in shape. And then fontanelle is also divided into four main compartments. First, we have anterior fontanelle. Anterior fontanelle is located at the frontal bone. This is the largest fontanelle, and it is a diamond-shaped fontanelle. And then it is articulate between the both parietal and also the frontal bone. And normally it will close after 18 to 24 months after birth. And then the second one, we have a posterior fontanelle, which is located at the posterior part of our skull. And then there is an articulation between the both parietal bone and also the occipital bones. And then normally this fontanelle will close after 2 months after birth. And then the third one, we have anterolateral, which is located at the anterior lateral part of the skull. And then there is consists of parietal, occipital, temporal, and also the sphenoid bone. And normally this fontanelle will close after 3 months after birth. And then the last one, we have posterolateral fontanelle. And then it is consists of 3 bone, which is parietal, occipital, and also temporal. And then normally it will close 1 until 2 months after birth. That's all for my part. Thank you.
Okay. For the anatomical structure are well suited to perform the function of they do. Skull is composed of several bones that articulate with each other at joints. Next, bone of the skull are relatively thick and strong, designed to be relatively rigid, and skull is shaped in a way.
Hi, I'm Atura. I will present regarding the physiology of muscle contraction for part of the spine. First is temporalis muscle, located here, located on the side of the head above the ear. Help close the jaw during chewing. Contraction will follow basic muscle contraction principles. Second is frontalis muscle, this is here, located in the forehead, raises the eyebrow and create forehead wrinkles, and then contraction is initiated by motor neuron activation with a side muscle fiber. Next is masseter muscle, is here, masseter muscle, powerful muscle, help close the jaw during chewing, involve movement of actin and myosin filaments. Movement leads to muscle shortening and force generation. Move to buccinator muscle, here, located in the cheek below zygomaticus muscle. It presses the cheek against the teeth during chewing. Help release air when playing with instruments and innervated by the buccal branch of the facial nerve. Orbiculus oculi muscle, here, encircles the eyes, it closes the eyelids. Contraction is regulated by green signal and protect and express the eyes. Orbicularis oris muscle, located around the mouth, contract the lips and regulate lips movement and speech and eating. Also, contraction is controlled by signals from the brain. Okay, zygomaticus muscle, here, located in the cheek area also, involved in smiling. They leave the corners of the lips creating a smile innervated by the facial nerve. This is a basic view of skull, AP view. This is a radiograph that I took from my hospital, and then this is a lateral view of skull.